A tragic warning: first U.S. measles death in a decade. It began with preventable symptoms, but ended in tragedy. A school-age child in Lubbock, West Texas, became the first U.S. measles fatality in nearly a decade. This heartbreaking loss occurs amid a troubling rise in outbreaks, underscoring the importance of vaccinations and public health awareness. Measles, once nearly eradicated, is making a disturbing resurgence. The child's death isn't merely a personal loss for one family, it's a wake-up call for the nation. What went wrong? And how can we prevent history from repeating itself? This isn't an isolated case. Texas has reported 124 measles cases during this outbreak, mostly among children aged 5-17. The virus spread rapidly across 9 counties, originating in Gaines County. But the risk isn't confined to just West Texas, it's everywhere. A majority of these cases involve unvaccinated or under-vaccinated individuals. Despite widespread vaccine availability, immunization rates remain dangerously low, below the 95% threshold needed to secure herd immunity. It's the perfect storm for outbreaks like this. Measles is highly contagious. With symptoms like fever, rash, and severe respiratory issues, it's more than just a childhood illness. Complications like pneumonia, encephalitis, and even death are possibilities. This virus doesn't discriminate, but thrives in communities with lax vaccination rates. The measles vaccine is up to 97% effective when administered on schedule. Yet misinformation and vaccine hesitancy have created pockets of vulnerability, where the virus spreads unchecked. This child's death is a stark reminder of what's at stake. Why are fewer people getting vaccinated? One issue is the pervasive spread of vaccine misinformation on social media platforms. Many people underestimate the risks of preventable diseases or believe discredited myths about vaccine safety. This is costing lives. In some Texas counties, especially in Gaines, vaccination rates are alarmingly low. A lack of accessible healthcare, cultural hesitancies, and mistrust in medical institutions compound the problem. The result, a perfect breeding ground for deadly infections like measles. This one case goes beyond a single family's tragedy. The economic burden on communities, from hospitalizations to public health interventions, is immense. Parents miss work, schools close, and hospitals face strain, all preventable costs of inadequate immunization. Not to mention, measles spreads like wildfire in crowded settings. Public spaces like schools, stores, and events like the Houston Rodeo are potential hotspots for future outbreaks. Are we ready to manage the fallout? It's not too late to turn things around. Free vaccination clinics in Lubbock and other Texas counties are stepping up to combat the issue. Health officials are working tirelessly to educate the public. Community leaders, schools, and families must band together to protect the vulnerable. Vaccination saves lives. That's not an opinion, it's a fact rooted in decades of scientific evidence. Boosting immunization rates is the most effective way to prevent another measles-related death. Tragedies like this expose the cracks in our public health systems. They force us to rethink how we approach healthcare, education, and access. This child's death didn't have to happen, but perhaps it can inspire a broader effort to protect others. We must prioritize truth over myths and action over complacency. Every decision to vaccinate is a step towards saving lives. Don't let another preventable death occur. Check your vaccination status and ensure your family is protected. Talk to your doctor. Share this message with others. It might save a life. Together, we can stop measles in its tracks. Act now.